After age 60, your body's capacity to absorb vital nutrients declines. Your nerves can become weak and damaged in a slow, silent process. Eventually, you might lose sensation in your hands or feet. While most doctors fail to warn you about this, I will. I am Dr. Thomas, and these 4 vitamins are essential to protect your nerves. Before we begin, if you are watching this, please leave a comment with your city or your age. I personally read every single response. If this health information matters to you, hit the subscribe button now so you never miss a video that could transform your well-being. Welcome back, everyone. I'm Dr. Thomas, and today we are addressing a frequently overlooked health crisis for seniors: nerve damage. You must understand that by the time patients seek help for nerve symptoms, the underlying damage has often been developing for years, sometimes 5 or even 10. The most unfortunate part is that much of this was preventable. Today, I will explain the 4 most effective vitamins that safeguard your nerves, repair nerve tissue, and maintain a strong nervous system well into your 70s, 80s, and beyond. These are not passing trends or high-priced miracle cures. These are nutrients your body fundamentally requires, yet your ability to process them drops sharply after 60. Stay tuned to Dr. Thomas, as this information could significantly improve your quality of life. First, let's examine what specifically occurs inside your body during nerve damage. Your nervous system functions as a highly complex network. Much like the electrical wiring in a home, billions of nerve fibers extend from your brain and spinal cord down to your fingertips and toes. These nerves transmit signals for movement, sensation, balance, and organ stability. Surrounding each nerve fiber is a layer called the myelin sheath. Think of it as the protective rubber insulation on a wire. It shields the nerve and ensures signals travel quickly and accurately. When this myelin sheath degrades, or when nerve fibers are harmed or exposed, signals begin to misfire. They decelerate and become disorganized, which is when physical symptoms emerge. What triggers this breakdown? Several factors are involved. Diabetes is a primary cause, along with poor circulation, toxins, alcohol, and specific medications. However, one of the most significant and ignored causes for seniors is nutritional deficiency. Your nerves require particular vitamins to function, mend, and shield themselves. When these vitamins are absent, damage occurs quietly in the background until it finally becomes impossible to disregard. Let's discuss each of these 4 vital vitamins individually. The first on our list is vitamin B12. If there is one nutrient every senior should understand, it is this. B12 is strictly essential for neurological health. It is directly involved in creating and maintaining the myelin sheath, that protective layer I mentioned earlier. Without sufficient B12, your myelin deteriorates, leaving your nerves exposed and fragile. The resulting damage can become permanent if it isn't identified early. The concerning reality is that studies indicate nearly 40% of adults over 60 have low or borderline B12 levels, often without knowing. This happens because B12 deficiency develops gradually over many years. Early signs like fatigue, minor tingling, or slight forgetfulness are frequently dismissed as typical aging. While B12 is found in meat, fish, eggs, and dairy, absorption is the main issue for seniors. As you age, the stomach produces less intrinsic factor, a protein required to absorb B12 from food. Therefore, even with a high B12 diet, your body may not be getting enough. This makes supplementation vital after 60. Sublingual forms, tablets that dissolve under the tongue, bypass the digestive tract, and enter the bloodstream directly. I advise my patients to check their B12 levels at their next visit and discuss supplements with their doctor. Daily intake for seniors should be 2.4 to 2.8 micrograms, though doctors often suggest higher doses for deficiency. The second vitamin is familiar to many, but its deep connection to nerve health is often misunderstood: vitamin D. Most recognize it for bone health, yet vitamin D receptors exist throughout the nervous system, including the brain and spinal cord. Research demonstrates that vitamin D is crucial for nerve repair, lowering inflammation around nerve tissues, and shielding nerves from oxidative stress. Low levels are directly associated with higher risks of neuropathy, nerve pain, and cognitive decline. The statistics are quite alarming, with studies suggesting over 70% of older adults are vitamin D deficient. Sunlight is the primary source, as skin produces it when exposed to UV rays. However, seniors often spend less time outside, and aging skin becomes less efficient at synthesizing the vitamin. Furthermore, many live in regions where sunlight is scarce for months. Food sources like fatty fish or fortified milk help, but are rarely sufficient alone. Consequently, I recommend vitamin D3 supplements, paired with vitamin K2 for better absorption, to almost all my senior patients. Ideal blood levels should be between 40 to 60 nanograms per milliliter, yet many patients test well below 20. A simple blood test can clarify your current standing. That I want to pause and share a story, because while statistics matter, real experiences make this clear. About 2 years ago, a 67-year-old retired teacher named Mia came to see me. She was very sharp, but had been feeling a strange buzzing in her feet for months. At night, the burning sensation was so intense she couldn't sleep, and she had begun tripping and losing her balance. Mia had seen 2 other doctors who suggested it was just age-related arthritis or circulation issues, advising her to take ibuprofen and rest. However, when I performed a full nutritional panel, the data told a different story. Her B12 and vitamin D levels were critically low, her B1 was below the normal range, and she had almost no alpha-lipoic acid activity. Mia wasn't suffering simply because she was old. She was experiencing early-stage peripheral neuropathy caused by nutritional starvation. We started her on a structured plan using the 4 vitamins I'm sharing today. Within 6 weeks, her foot pain decreased by half. Within 4 months, she was sleeping through the night. After 1 year, her nerve test showed measurable recovery. Mia was moved to tears, saying she thought this was just her new reality. I told her then what I'm telling you. It doesn't have to be this way. You are not helpless, and Mia's success is something I see frequently. Let's move on to the 3rd vitamin, vitamin B1, also known as thiamine. This is one of the most established vitamins and is fundamental for neurological operation. Every nerve cell in the body needs thiamine to generate energy. Without it, your nerves effectively run out of fuel, leading to a loss of function and an inability to repair themselves. Thiamine deficiency is a well-known cause of peripheral neuropathy and is linked to severe conditions like Wernicke's encephalopathy. While extreme deficiency is often associated with alcohol use, mild to moderate deficiency is quite common among seniors. This occurs because thiamine is water-soluble and not stored in large amounts by the body, requiring a steady daily supply. As appetite and dietary variety often decrease with age, or as medications interfere with absorption, levels can quietly fall. Good sources include whole grains, legumes, nuts, and lean pork, but absorption remains the primary hurdle for older adults. Supplementing with B1, typically through a B-complex, ensures your nerves have the necessary fuel every day. The recommended daily amount for seniors is 1.1 to 1.2 milligrams, though therapeutic doses for treating neuropathy are often much higher and should be reviewed with a physician. The 4th and final entry is a vitamin-like compound called alpha-lipoic acid, or YLA. YLA is unique because it is both water and fat-soluble, allowing it to work in nearly every tissue, including deep within nerve cells. It is one of the most potent antioxidants known and has been studied for decades regarding neuropathy. In Germany, it has been a recognized medical treatment for diabetic neuropathy for over 30 years. Research proves that ALA supplementation lowers nerve pain, enhances nerve signal speed, and assists in regenerating damaged fibers. It works by neutralizing free radicals that attack nerve cells and by recycling other antioxidants like vitamin C and E. It also boosts blood flow to the nerves, which is vital for nourishment. While the body produces small amounts of ALA, and it is found in spinach, broccoli, and red meat, the levels in food are minimal. Therapeutic doses used in studies, usually 300 to 600 milligrams daily, require supplementation. If you are experiencing any nerve symptoms, YLA is one of the primary supplements I suggest in my practice. To summarize, B12 for myelin and signaling, vitamin D for repair and inflammation, B1 for energy, and alpha-lipoic acid for protection and regeneration. Together, these provide the tools your nervous system needs to remain strong. To be clear, supplements do not replace professional medical care. If you have significant numbness, burning, or loss of balance, please see a doctor for a proper diagnosis. However, in my experience, nutritional deficiency is a major, treatable cause of nerve damage in seniors. Too many people suffer because no one checked their nutrient levels. Don't let that be you. Here are 5 practical steps. First, ask your doctor for a nutritional panel covering B12, vitamin D, and thiamine. Second, improve your diet with B12, rich foods, and leafy greens. Third, consider a high-quality B complex with methylcobalamin, which is easier to absorb. Fourth, take a vitamin D3 supplement, preferably with K2. 1,000 to 2,000 IU is a standard start, but follow your doctor's advice. Finally, discuss alpha-lipoic acid with your physician if you have symptoms. These are simple, science-backed changes that can greatly affect your daily life. I entered medicine to help people live better, and it is frustrating to see seniors accept pain as inevitable when solutions exist. You deserve to live without pain and move with confidence. These 4 nutrients are powerful tools your nerves require. Discuss this with your doctor, share this video, and remember it is never too late to prioritize your health. I'm Dr. Thomas. Thank you for watching. Please like and subscribe to Dr. Thomas for more practical health tips for seniors. Your journey to better health continues, and I am here to guide you.